So Andrea, you work here at Bodystream. You are the registered nurse, and I know that you wear many hats. And today, one of the hats that you're going to be wearing is my colon hydrotherapist. And I really appreciate your time and allowing me to videotape this because it is my first colonics, and I'm excited to have it done. And I trust you as a person and as a healthcare professional. And I am excited to to experience what other people that I've noticed have been experiencing. So I have some questions. They're kind of straightforward, and this is all very new to me, so my lens is from a newbie perspective. So the questions might not make sense, and I apologize for that. I know you're the type of person where no question is a stupid one, so I already appreciate that. So starting from the beginning, when I came in, I filled out forms. There was specific forms for colon hydrotherapy, and I just am wondering what those forms tell you.
The forms that we have you fill out, well, first off, it's a consent form, which is kind of important. You need to give us permission for us to be allowed to go below the dermis. But it also tells us a lot of good information about your digestive system, how your bowel movements are, what you're experiencing, what your life is a little bit like, a food journal for the last few days, just to see what types of food you're eating, how you're drinking water, what your actual goals are, so that we can really cater to where you're at.
Okay. How long will this procedure take?
It usually takes about an hour from start to finish. You're usually hooked up to the machine for about 45 minutes. We try not to keep you on much longer than that because we don't want to overwork your colon in any way.
Okay. Are there any foods or beverages that I should avoid on the day of the procedure?
I would avoid anything really heavy or really gassy.
Like?
Well, it depends on what. Broccoli can make people gassy.
Okay.
Pop can make people gassy, although that's not healthy for you at any rate.
Should I drink lots of water? Should I drink extra? I know you should always drink lots of water. I'm learning this as we go along. But should I drink extra amounts of water, or what do you recommend?
I recommend between 3 and 4 liters per day, unless your health history suggests otherwise, and I don't feel the need to up it if you're having that constant amount going into you.
Okay. What are the fees associated with colon hydrotherapy?
Well, usually a colonic here at Bodystream is $80 plus tax.
Mm-hmm.
We do have additional implants that we do that are $10 a piece. Aloe vera, we have bentonite clay, we have a probiotic implant, and of course my favorite, coffee.
Okay, that sounds like it would be something for a more seasoned patient, not for a first timer like me.
No, I tend to like to do implants when we already know how the colon is working. In the first one especially, I like to just get to know you and what you're going to do first. Although the implants are amazing, they're very healthy for your colon.
Okay. Is this procedure sometimes covered by extended healthcare benefits or not typically?
Sometimes it is. I've been finding that some people have this, what do you call it? It's just a pot of health money.
Mm-hmm.
Some of the insurance companies have it, and they have been accepting the colon hydrotherapy under it.
Perfect. That's good to know. Will I be given a sedative? And I've had a colonoscopy before, and I know that they're very different, but the procedures seem somewhat similar. Will I need a driver to take me home after this procedure?
No, I'm not going to give you a sedative. This procedure works much better if you are involved in the process. I actually help you learn how to listen to your colon so it can be more effective, and you won't require a driver going home.
Okay, great. Do I need a medical requisition from my family doctor? Or is this something that I can set up my own appointment?
You can set up your own appointment for colon hydrotherapy. I do like to talk with doctors. As an RN, that's something I commonly do, about the healthcare, and there are a few patients that I see that I worked actively with their doctor, naturopath, healthcare provider of their choice, just to improve their health.
Okay. What if I have hemorrhoids or piles? Is it still safe to have this procedure?
It is still safe to have this procedure. With hemorrhoids, that would be the biggest concern because they're quite painful. We do not do a colonic when you're in that constant difficult pain that you can get with a hemorrhoid.
Okay.
And then when you're not in that, we certainly do them, but we lubricate really well.
Okay.
And usually there's no irritation whatsoever.
Perfect. What if I have diverticulitis?
Diverticulitis is something that colon hydrotherapy, we can help, but especially not in acute phase.
Okay.
You cannot give a colonic during the acute phase. It will be very painful.
Okay.
And we just don't do it.
Good to know. Is there anyone who should avoid having colonics for medical reasons?
It would depend on the health history, and that's why we do it ahead of time, just to have some understanding, because there are some things that we do not do colonics for. It's one of the things that I'm very particular about is I don't give colonics when someone is pregnant.
Okay. Okay. Can I go back to work the same day?
Absolutely.
Okay, that's good to know. Will it be painful? Will my rectum bleed?
It shouldn't be painful. Your rectum won't bleed.
Okay.
What you will feel is maybe some bloating, some
Okay.
cramping, and some pressure as your colon fills up with water.
Okay. Sorry, I have lots of questions. Will there be an embarrassing odor in the room?
No. I use this tube here. We have a speculum that is just a bit smaller than your rectum, which is why it slides in nice and easily. And it's attached to two tubes. This is the clean water going in, and this is the large tube where stool and gas comes out. And that's where all the odor sits. So there is no real odor in the room.
Perfect. And
in the bathroom, yes.
Okay, all right.
Afterwards, usually.
But that is a private, separate room, and
Yeah.
and I'm on my own for that one.
You were on your own for that.
Thank you, I appreciate that. And although we are doing this video, I'm actually a very private person and very body shy. How will you minimize my embarrassment during this procedure and respect my privacy?
That's very important for me to do, and what we do is this sheet here, I drape around the tube, so you actually can't really see anything. I don't really actually see anything except for the tube as well.
Okay.
So both for camera and myself, you will be very well draped.
Much appreciated. And how do you ensure sanitation and minimize the risk of passing bacteria from one patient to another?
Well, the biggest thing is that these are disposable speculums, so
Okay.
they're one use only.
Okay.
And the other thing I like to do is our machine, which I think is the best, is a closed unit. There are several units out there that are very open to air, and you can get airborne bacteria at any point, whereas this is completely closed. And so I think regarding infection control, we're very good.
Perfect. Could you explain a little bit about how this machine works?
Certainly. What happens is that we have water. We hook up the water tube here. So we're actually going to put the water through into you at a very regulated flow.
Okay.
Okay, so it's not too much, not too little.
Okay.
Normally we run from about 2 to 3 psi, where studies have shown that your colon can actually take up to a 17 psi. So we're well within
Okay.
the limit of safety.
And sorry, what does PSI stand for?
Pounds per square inch.
Okay, that's the pressure.
Yep.
Okay.
So that is going to control that for me, which is very nice. The waste is hooked up to here, so I can actually watch your whatever's removed here, your stool, if there's any mucus, parasites, anything interesting. I can tell if you don't chew your food well enough or things like that. So I
Okay.
mean, that tells us there. And then this is hooked up to the sewer system, so it goes straight out to the sewer.
Oh,
And it allows us to be very clean and odorless.
perfect. Okay. And you mentioned that you were looking for particular things in my stool. What can it tell you about my digestive system?
Well, it can tell me if you're able to digest, if you are digesting. If there's a lot of undigested food, what can happen is you may not be chewing enough. Chewing actually can activate enzymes in your mouth that actually help break it down. You may require a supplement of enzymes. That can certainly help, but I mean that itself, if your stool is very dry and hard, I would tell you to definitely increase your water intake.
Okay.
If I see parasites, which are not always able to be seen by the eye, so when I see them, they're quite large. We can work on a diet and a cleanse to help you with that.
Okay.
Also, we can see yeast, so there's also diets and cleansing for that.
So you can physically see a lot.
Yes.
Can't wait. And as you know, and we discussed this before this, but my initial lab screening that was done by the in-house naturopathic doctor, Krista, revealed a level 3 result for multiple microbial. How common are parasites in people?
Parasites are actually very common. If you have a dog, if you have chicken that has parasites in it or anything, or you can even pick it up from a person. So parasites are actually very common, and I've actually myself have had live blood cell done, and mine was very good. It took quite a time before you could see a little bit of a parasite. So I mean, I actually sometimes feel like we all have parasites. It's whether our body is able to maintain them or not.
It's kind of freaky, but good to know that it's not just me with a belly full of parasites and bowels full of parasites out there, so thank you for sharing that. And so this was recommended to me along with, I'm on an intensive probiotic, and now she's added a clove supplement as well. And she's recommended the colon hydrotherapy on top of this. So is that to purge? Is stuff stuck in my bowels? Like, is stuff that typically should be coming out isn't? And this procedure will kind of wash it all out quickly, like more quick?
Well, it will definitely. Your colon is actually kind of like this large tube here. It has crevices, and stool over the years gets stuck in it if it's not working effectively. So if you have any type of constipation or any bowel distress, you're going to have lots of stool stuck in there, and it could be there for months, years, what have you. So I mean, the colon hydrotherapy will just soak that out so that you can certainly have an improved functioning colon.
Because that can't be good for you, having stool stuck in there for long periods of time.
No, it rots and putrefies, and it's just nasty.
It causes, I guess it would be a toxin to a degree.
Mm-hmm.
Wow. I hope that's not the case. We'll soon see. So, and I know that there are a lot of benefits, but what will colon hydrotherapy, what are the benefits that it would have for someone like me? Like, how will it make me feel better?
Well, I think for you, because you're looking to detox, it'll actually support your liver in helping you detox, and your colon will help you detox as well. And if it's moving more effectively, you can actually remove more toxins. But for you, some of the symptoms you might find is increased energy.
Ooh, yay!
You may sleep better at night.
Oh my gosh, that would be fantastic.
You will have better bowel movements.
I don't even know what that's like.
Yes, well, that's a very important thing.
I'm excited. And I hear the word detox a lot at Bodystream in different capacities. Could you please explain what detoxing means and how colonics can assist in the detoxification process?
Well, detoxing is basically ridding your body of toxins from everyday life, because it can happen at any point. So what we're doing, I mean, I'm actually planning on doing a detox this weekend for my liver that we have here at Bodystream. And what it does is actually cleans out the liver and pushes toxins into the colon where it's released. But during a cleanse, if you're not releasing more stool or more gas, then you're not actually relieving yourself of the toxins. So the colonic will actually pull it out. I like to have a colonic before my cleanse and after, just to really improve the release. Because what happens if you don't release the toxins through your stool or another detox organ like your skin, it can actually reabsorb back into your bloodstream.
Oh.
and it just basically shakes up all your toxins.
Oh.
Yeah, so detoxing is very important.
Okay.
But you need to ensure that you're able to release it.
Okay, that makes sense. And before this procedure, Alan put me on the magnetic bed with a specific focus on my stomach with the smaller mat. Why did he do that?
Well, the magnetic mat is one of, I absolutely love it here. What happens is that actually takes stress off your cells. Because when your cells are stressed, they become very concave. But if we remove the stress and they become nice and bouncy again, they'll actually function better.
So I'll get a better result from this?
Yeah.
Okay. The majority of patients having colonics are adults, but I have also seen children and youth as patients too. Is this therapy safe for children and youth?
It is. I usually assess the child though. I've never gone beyond 9 years.
Okay.
And again, that depends on weight as well and on health history.
Okay. And as you know, my background is in mental health, and I've heard that there is a significant relationship between the digestive system and the brain, and I'm really starting to learn how critical this connection is and how important it is, and that colon hydrotherapy is receiving impressive results for children and adults with mental health disorders and in the autism community. Can you further explain the gut-mind relationship and why this recommendation is becoming a more common practice among healthcare professionals?
Well, there's a few things that I can say to that, and one of them is that when your body's able to release the toxins, you actually get much better mental clarity. So your mind is working better. One of the other things that I really like about it is one of the wonderful functions of the colon is that 98% of your serotonin is actually made in those crevices of your large colon. So if you are unable to move or contract and it's jammed full, you're not actually able to make that percentage of serotonin, whereas 2% is made in your brain.
I'm sorry, this is a huge light bulb for me, like a huge light bulb for me. I had no idea. That, in that sentence, clears up for me the connection and how important this is so that this can be.
Absolutely.
Awesome. I love light bulb moments. I'm sorry, and we're almost done the questions. Will I have gas afterward?
You may or may not.
Okay.
After the colonic, I do send you into your own private bathroom. You may or may not have more release, and the release could consist of gas, water, or stool.
Okay. And will there be a change in the look of my stools after this? Like, is there something that I should look for or be concerned about, or will I not have a movement for a couple of days now that everything has kind of been flushed out?
Mm-hmm. Usually it takes about 24 hours for the average person to have a bowel movement after a colonic.
Okay.
If your colon is functioning well, you will have it sooner than that. If it's not functioning as well and you need to exercise it more, you might take a little bit longer.
Okay. And I guess you would have to wait to see what your recommendations would be for a colon hydrotherapy treatment plan for me after the first colonic?
I would. I like
Okay.
to assess the way your colon works before I set up a treatment plan.
So shall we begin?
Certainly.
Okay.
I would encourage you to go to the bathroom because the bladder and the colon are very close together, and through osmosis I will make you want to pee.
Okay.
Then you can disrobe, put your bum on the blue pad, and then pull this sheet up over to your waist.
Okay.
Okay.
Can I leave my top?
Yep.
Okay. So everything off underneath?
Yes.
Okay.
You would have